We're focused on Plan A, and that is repealing and replacing Obamacare. The president's fully engaged, as along with his administration, in working with House and Senate members to make sure that we repeal and replace Obamacare and put in place a health care reform system that is sustainable and that works and serves all Americans. And that's the focus right now, and that's the only focus. Said the president's been very engaged in this process, as have multiple members of his administration, and he's made a lot of calls directly to members. He had roughly, I think, 46 members of the Senate here yesterday. They had a long and lengthy and very good and productive conversation. We're going to continue doing that. Just like he did with the House, he was engaged and making sure that happened. And he's somebody, we've said before, I would never underestimate this president, and if he's committed to getting something done, he will. I mean, I think you're talking about it as if it's over, and it's certainly not. I mean, again, this is part of the process, is walking through. We've said from the beginning that there were going to be changes that would probably take place within this piece of legislation. That's where we are. Again, the president's been directly engaged and will continue to be so. Sure.
That is sound from the audio-only White House press briefing that took place just a short time ago. Sarah Huckabee Sanders, the deputy press secretary there, we heard her voice. We're not allowed to turn on our cameras. Chief White House correspondent Major Garrett was in the room. And Major, just in that little clip that we just listened to, I heard Sarah Sanders say that the president was fully engaged, directly engaged, and very engaged with this health care debate on the Senate side. It sounds as though the White House wants to try to combat some stories that have reported otherwise, that this president not fully engaged and not fully aware of the details of the Senate health care plan.
Well, he's engaged now, Rick, but he wasn't before. That's just a fact. Vice President Mike Pence was heavily involved. A significant person in this White House, Mark Short, the head of legislative affairs, was significantly involved. But until yesterday, this was largely the legislative handiwork of the Senate Majority Leader, Mitch McConnell. And it was his desire and his design to write this bill in private, not in public, among a chosen 13 Senate Republicans, and then bring it to the floor, have it passed this week. That was the original schedule. And the White House deferred in many significant respects to not only the way the bill was drafted, but the schedule put forward by the Senate Majority Leader. And then guess what? The votes were not there. Then the White House had to get more directly involved and say this was not only a priority for Senate Republicans, but this White House. So it is true, the president is engaged now. But the level of engagement is still open to question. One of the things I asked Sarah Huckabee Sanders was, after the president spoke with Senator Rand Paul, one of the no votes in the Republican caucus now, he said publicly that the bill before the Senate, as currently drafted, doesn't repeal the Affordable Care Act, and that's one of his central grievances. So I asked Sarah, does the president agree that the bill doesn't fully repeal the Affordable Care Act, and that part of it needs to be changed? She said, I have no idea. I've never talked to the president about that. Now, that's not a granular level of detail, Rick. That is a pretty significant, big picture question. Does the Senate Republican draft fully or largely repeal the Affordable Care Act? Yes or no? Some of the no votes, and Rand Paul's not by himself in this, Mike Lee of Utah, Ted Cruz of Texas, possibly others, don't think the draft goes far enough. Today, we don't know if the president does either, and what he'll accept or won't accept when this drafting process reaches some extra stage. So the White House can talk about engagement, but when you deal with it and there were questions to Sarah Huckabee Sanders that were far more specific than mine, but mine was pretty general, sort of right in the sweet spot. And they don't have an answer for that either. So engagement is one thing, but details and what you're willing to sign and what you're willing to accept still remain somewhat of a mystery.
Well, Sarah Sanders said that the president is involved in the Senate process, just as he was with the House version of the bill, which, of course, they were able to get over the line by the hair of their chinny chin chin. So it seems like the president was effective in the House, but is he going to be able to does he have the juice, I guess, is the question, to do the same in the Senate?
Well, let's go back to the House process. Yes, the president was effective in the sense that he said, this is my priority and I want you to keep working on it. But there were some fits and starts in that process as well. If we all remember the president's Twitter feed, for a while he played footsie with the idea of abandoning recalcitrant House Republicans and maybe dealing only with the Democrats. That was swiftly abandoned when the Republican leadership in the House said, no, Mr. President, that does not help our cause, yours or ours. Let us try to sort this out ourselves. And House Republican leaders and many rank and file members of the House Republican Conference did that work themselves. Certainly with encouragement from the president, but by no stretch of the imagination would you call it detailed, analytical policy advice from this president on what the House ultimately passed. And what we're seeing in the Senate is largely the same kind of arm's length engagement. Leave the details, the legislative drafting, and the consensus building to the Senate Republicans and just say, in the end, I want it done and it'll be great and I'll live with whatever it is that you pass that comes my way. That seems to be this White House's principal means of engagement. Whatever can pass and whatever can build consensus each and every step of the way. But there is no sign when you engage the White House on these specific questions about Medicaid or opioid addiction and money for either, or whether it fully repeals the Affordable Care Act or not. The White House simply doesn't engage at that level of specificity, leaving that work and those details to Senate Republicans.
I'm sure that somebody's keeping track of how many times the president has promised something in the coming days and weeks, some kind of a big reveal. Mark Knoller, I'm sure our CBS colleague, has a running list of those things. But once again, we heard the president today promise some kind of big surprise when it comes to health care. He was meeting with some members of the World Championship Chicago Cubs team at the White House today. He said there's going to be a big surprise. Everyone's going to like it. Do we have any idea what he was talking about?
No, but the only thing that it strikes me as a possible big surprise is a consensus by Senate Republicans by the end of this week. Something that is redrafted, something that brings together disparate and currently disagreeing parts of the Senate Republican Conference on some of the main sticking points, which is Medicaid allocations in the future to states that have accepted Medicaid and expanded access to it under the Affordable Care Act, opioid addiction and the funds necessary to address that problem in some key states, some key pro-Donald Trump states during the campaign, it's worth pointing out, and other elements of the bill that have attracted some opposition with other Senate Republicans, specifically funding for Planned Parenthood. It would be a big surprise, Rick, if by Thursday or Friday, meaning tomorrow or the next day, Senate Republicans, who are so publicly quarrelsome right now about the underlying details of this bill, all found a way and a harmonizing draft that they could all sign off on by Friday, then have the Congressional Budget Office rerun that draft through its analytical process, produce a score on the budgetary side and the coverage side, meaning how many people might lose coverage under this redrafted proposal. So it would be ready for Senate consideration on the floor of the Senate a week after the 4th of July recess. That would be a big surprise. Short of that, I can't imagine anything in the healthcare sphere that would amount to a big surprise.
All right. Before we let you go, Major, I want to switch gears. One other topic that came up at the briefing today, Syria. Of course, we got that warning from the White House late Monday night to the president of Syria, Bashar al-Assad, and his forces there. Do not plan or carry out another chemical attack on the people of Syria, as has happened in the past. That coming up in the briefing today. What did Sarah Sanders have to say?
Well, again, the White House will not discuss what it saw that it believed constituted preparations and preliminary preparations for a coming chemical attack. And it says, since there was a statement from the White House and since in the intervening hours and days there has been no use of chemical weapons, the White House statement worked. Now, our David Martin at the Pentagon, my colleague, an exceptional reporter there, has said there's no evidence that the Pentagon has seen that there's anything different going on in these areas that brought attention to this White House in the first place. So there doesn't appear to be any change of behavior on the ground, but the White House wants to assert, well, we said don't attack, there hasn't been an attack, therefore we have been effective. That's one message from the White House. People can evaluate that as they choose. The White House also took pains today for the first time, because it did not answer and would not answer these questions yesterday, about the internal process that led up to this statement, which was highly unusual, in the sense that it left the world with the impression that Syria might do something any minute now in terms of a chemical weapons attack. And what the White House said was this went through a thorough vetting process involving the CIA, the Director of National Intelligence, the Pentagon, the State Department, because there had been many stories written in the immediate aftermath of this White House statement that many of those key agencies were not, if not left entirely uncertain about this statement or its preparation or how it came about, not as well briefed on it as they would have preferred to be. The White House today very aggressively tried to push back against that, saying everyone who needed to know about this did know about it and, more importantly, signed off on it in advance.
Chief White House correspondent Major Garrett at the White House for us. Major, thank you very much. Good to talk to you.